All right, so I'm here with Carol and Sharon. Is that okay if I?
Yeah,
I know. It's,
absolutely.
it's like a movie. It's like a buddy cop. Got Carol and Sharon here to take you to Genomics jail if you don't do the right thing. Okay, so you're the co-founder of IntellxxDNA,
Right.
and that amazing company, and we're going to talk more about what you guys do, and we're excited to talk about that. But tell us a little bit more about the company and how it started.
Great question. So we didn't start with a business plan. That was not what we had in mind. Actually, we saw a gap in what was available for patients. And we were looking for something that would bring a level of precision care to patients that we brought to the patients in practice. And we both had actually, before we'd even known each other, been working on genomics and studying genomics. And we knew we wanted to bring it into the practice when we joined forces. But when we looked at different platforms, there was nothing available that brought the actionability to genomics and certainly didn't bring the clinical evidence to it as well. There was whole genomic sequencing, there was exome sequencing, but we were looking for more information on the chronic conditions, on cognitive decline, on autism, and we couldn't find anything. So we started culling a lot of information in our own practices, and we have 100 notebooks maybe of information. And then we started to recognize what it was doing inside of our practice. And when we started sharing that information with the patients, it was an unbelievable change in them. That validation that they felt was phenomenal because finally all the symptoms that they were experiencing were grounded in medical information. That was empowering for them, and it was empowering for us because everything that was not visible is now visible for them. We couldn't keep it to ourselves, and so we started building the company.
Most people have heard about a 23andMe.
Right.
Mm-hmm. And that's more of your genetic testing. We're talking genomics.
Right.
For someone who's not familiar, what's the difference between those two?
Well, I'm going to let our medical director
Okay,
handle
you want to do that
one.
one? Okay,
Absolutely.
Yes.
So genetics is the study of things that are inherited. So a classic genetic illness is something that you can be either a carrier or have. So sickle cell, Tay-Sachs, cystic fibrosis. There are specific genes, and if you have a gene variant or two, depending on whether it's dominant or recessive, you get that disease. However, it's only a really small percentage of diseases that are fully genetic, where they're inherited with one gene. The most common situation is that chronic diseases, everything from ADHD to cognitive decline to fatigue, heart disease, diabetes, dementia, it's not because of one gene variant, so it's not because of anything that's going to cause the disease, but it's a combination of a lot of little changes in a DNA adding together with each other and then interacting as well with diet and environment. So cognition can be interactions between inflammation, oxidative stress, but also things that are more structurally related to the brain. And so all of this is what the field science of genomics is saying. Let's look at the small changes in an individual's DNA that are not disease causing by themselves, but when you add them together with that patient's diet, lifestyle, etc., you have the disease and with each other.
Got it. And I've been trying to think about a way to think about this even with patients, where in a way, when I think about the genetic diseases, it's kind of like stone.
Yeah.
Mm-hmm.
And this is like almost like clay, where it's not just, it can take many shapes. It just depends on how the person manipulates
Exactly.
that clay. And so I think that's a big difference. That's a huge difference.
Absolutely. And it's a difference in terms of what tool somebody uses. Because if you're looking to see if somebody has a genetic disease, those diseases are called due to pathogenic genes. They're not common, and that's where whole genomic sequencing can help, is to look for a single disease-causing gene. But what we're doing, and most of your listeners are probably integrative or functional medicine trained or interested in longevity and a different approach, is you have to look at these genes that are common. They might be in 1%, 5%, 10%, 15% of the population, and those won't even show up on whole genomic sequencing or whole exome sequencing because they're not considered, they're considered benign. Well, but that's just the definition is, well, it doesn't cause a disease by itself.
And that's actually part of the reason why we decided to work with a lab directly. We created our own sequence. We culled all of the specific SNPs ourselves based on the clinical evidence that was available.
In the literature.
In the literature, exactly. And then we created that sequence. And so lots of times people will come up to us and say, well, I got my DNA done from 23andMe. Can you just use that? Well, no, we can't, because one, they weren't looking for what we're looking for, but also the level of accuracy that we have is much higher because we're expecting a clinical level of accuracy.
Right. So, and let's kind of take it back to the patients, right? Because again, those are the people we're going to be doing the tests on.
Right.
And so this root cause genomics that you guys have developed, how does that actually benefit the patient? As in, if they're going to see it, obviously it's like, hey, is it a prediction? Is it a risk thing? Or it's like, hey, you have this, you should probably take these supplements or these medications. So how does the patient take that and say, what's the benefit for me in doing this?
Well, usually they're very excited and they come to us asking for the genomics because they're already informed, frankly, because of companies like 23andMe and Ancestry DNA. They're excited about what they can learn about their own biology. And what they don't yet know is that the companies that do direct to consumer testing don't actually provide that information from a health status. So when they come to us, they're really excited. And what they're trying to do in many cases is solve some mystery that they've been living with for decades. And when they get information about themselves that's unique and targeted, they aren't just empowered, they are overwhelmed. They sob because they are relieved to know that there's medical evidence that supports them. They knew that there was something going on, but they couldn't find the words and they couldn't find the right practitioner. And then to know that there's something they can do about it, that's incredible.
And we don't put gene variants in an IntellxxDNA report. We don't put something that a clinician cannot use because what would be the point of saying, oh, you have this gene and it's going to give you FTD, frontal temporal lobe dementia, if there's nothing we can do about it. So in fact, like just this year, we added some of the genes that related to FTD and to tau, and it's not a risk calculator, it's not a prediction, it's a disease contributing gene. It's in the literature, this particular gene variant can double your risk or can affect the risk, but we don't add it until we've already done the research and said, but this is what this gene variant does, and here's some things you can do to modulate that, because it's meant to be empowering, and it is. And I think that it's written in a way that can be used for prevention or for someone starting to have symptoms, and so it's very malleable depending on what the patient's needs are.
How are they using it, if that makes sense? Like, how is it benefiting the practitioner? Because is it like I've got, and again, we were talking about this on a different call. I was like, the first time I got that report, I was like, oh no, I can't do this. This is overwhelming, right?
Right.
But how do those practitioners, how can they actually take that and begin to use it to benefit the practice itself? Does
Sure.
that make sense how I'm asking?
Absolutely.
It's like, how do we shift it from the patient to like, I'm the practitioner, how is this going to help me?
Right.
Yeah.
So the first thing is that we are bringing information to the practitioner that was essentially invisible before. That biology that becomes visible to the clinician now changes the conversation in the mind of the clinician. Aha, I have new knowledge that I didn't have. And we've created it in such a way that the organization provides a structure for the clinician to use with the patient. So that supports them in removing a lot of that trial and error process, but it also builds their confidence because they begin to recognize, aha, I've got this patient and this patient. They have symptoms that are very similar, but they're not. And so with that biology now visible, they know what the right treatment is for this patient and this patient.
And I can tell you, like, as a practitioner, as I've been using it, I'm probably a good year and a few months into it, and now it's starting to make more sense. And now I'm having these conversations with patients where it's like, when allergy season kicks in, are you really struggling with it? They're like, oh my God, like the worst allergies. And it's like, really?
Right.
And then I'm asking a question like, how about your siblings? Oh man, we all got these bad allergies. And then I just kind of pull it out and it's like, hey,
yes,
look
it's
at this.
very validating on both sides.
Because they are literally, and I'm going to talk about this tomorrow, it's like I'll start talking about their appetites and their history of weight, weight loss and obesity. And it's just like, no. And you mentioned that, I almost wanted to cry because I've had patients like, look, I've seen all these nutritionists and dietitians and they're just telling me to work out harder.
Right.
And I'm doing all these things and I'm not losing weight. And you're just like, hey, it's a little bit more than that. And they see that and it's like, oh my gosh. And it's almost the weights off their shoulders. And not just knowing it, but here's what we can do about it.
Exactly.
And that is amazing.
Absolutely.
Yeah.
And there's so many things like that, with weight, but in mental health where people get labeled, oh, You just
Right.
get over it. You're a depressed person.
Right.
And then you find out that they are in the 4% that are missing one of the main cofactors, like it's called tetrahydrobiopterin, for making all of their brain chemicals, in addition to maybe MTHFR. And then you're like, oh, and you give them tetrahydrobiopterin and they no longer need antidepressants.
And their whole life changes.
And so there's other people as well that are labeled because they have pain and they go to a doctor and they can't find why they have pain. And again, so much of medicine, we've labeled people. Then you do the genomics and you figure out that they can't absorb B12 and transport it into their brain, which dramatically changes pain sensitivity, and that they're at 7 times higher risk for being sensitive to gluten. You give them some B12, you get rid of the gluten, and that helps their pain. I mean, and it's not always as simple as 2 gene variants, but you can, instead of shooting in the dark, when you have genomics, for many chronic diseases or common diseases, you now can dissect what's going on and have a different conversation. And most patients find that extremely empowering.
Oh, it really is. So it's good that I'm doing this. It's like, I've seen it, I'm there, I'm
Yeah.
actively using it. I want to do more, and so we're really trying to.
Well, we've even found with patients who are, in their late 60s who decide to do the genomics testing is that they find out things about themselves that are really quite relieving. They go, aha, that is why this has happened, and and that's been the progression of my health. Now I have an opportunity to do something different. But it's
great,
not just with that patient, it's with their whole family.
Right. Oh, I've had a couple people who have done it, and next thing I was like, oh, my spouse wants to do it. I want my kids to do it. And like,
You were asking about how it could benefit practices, and I was just going to say, for a new clinician who is still trying to grow their practice and has space, it's a great way to grow the practice because it takes years to learn all the different tools that we learn here. How do you use all the different supplements, the peptides, the different tests? Well, we have a lot of the support for making those decisions in the tool, so it supports you, and you can go, aha. Now I know where apigenin fits in. Now I know how I can support BDNF. But it also supports you in that as soon as you know how you said, oh, I can tell they had allergies. As soon as you're going, so do you get gut stuff every now and then, or do you get this? And you're able to be that kind of magician and see what's going on and get them better, then they bring their friends and family. So it's a great way to grow a practice because it helps you get consistent outcomes and learn along the way.
Which is great.
Can I just add one more thing?
Please do.
Sharon, tell Greg about the story about the doctor who started with us a few weeks ago and called because her friends said that she was so happy.
Yeah. So one of the things is we also, here we're at Calm, we're talking more about longevity, but we also have a very large pediatric following. And pediatric patients, their brains, children, are so plastic, and that we've had so many people that have autism, severe behavioral issues, non-speaking, that literally within 2 to 5 weeks, after parents have tried everything, are seeing huge improvements. And it's not that we're magic, it's that we're unlocking the code to what's going on for them. And so we do frequently, we had one child go up 5 grade levels in literally a matter of 2 months in their reading ability.
That's so cool.
We've had people get rid of their seizures and change speaking, the self-injurious behaviors. And again, that's a completely different field, but I use this as an example because of course, these people have seen other doctors. And so the new exciting thing is all those examples I just gave you were cases from a first-time doctor, because they do it in their first 3 reports.
Wow.
And so even though you say there is a learning curve, well, that's because you and I, we want to get really in deep. You're going to give a fantastic talk tomorrow on the root cause of some of the obesity, and we're people who like to get really into the weeds. But even using it at its basic level and following, because we do give reference potential interventions, you can kind of follow the map and start to get outcomes even on your first patient.
Yeah. What's coming next for IntellxDNA?
We have some big things coming out, hopefully by the middle of this year. So we are refining the tool, the platform, developing it to more of an ecosystem. So the doctor will be able to use a clinical intelligence layer that supports them in their thinking and be able to ask it questions and understand the biology even better than they do now.
And it'll make it a lot faster to make your report. So it's a watch for your emails. It's going to say there'll be emails coming out this summer for people to be able to see the new additions. It is going to be very exciting because it's going to shorten that learning curve dramatically.
That's so great.
And we have a conference for anyone who wants to do more in-depth learning in July 24th, 25th. That's where we will be rolling out some of these new tools. And it's in Austin, and a great way to become a genomics expert in a matter of a weekend, because when you go through 15 cases and get experience with 12 different faculty, you're like, okay, I've got it.
Yeah, it starts to make sense.
Yeah.
I would say it clicked for me around report number 4.
Yeah.
I was like, okay, I'm starting to get this.
That's
It's
pretty
not-
typical.
It's not so overwhelming.
Yeah.
And it's, I guess I can say I started off in the beginning where it was like all manual. So like for me, the beginning, right?
Right,
I caught
we
the
didn't
end of
have all
that.
the- we didn't have all the
now
tools
it's like
we
this
have now.
tool, and I'm like, and I was slightly resistant. I was like, I just learned how to use the manual. Why are you doing this tool? I'm so
And the next layer is even more fun.
yeah,
Yes.
I was like, okay, but it's great because the thing doing it manually and the tool is that you start to see patterns,
Right.
And that's why, because again, if you just look variant by variant, you're like, oh my god, I gotta give this person 80 supplements. No one's gonna take
Yeah.
80 supplements. But then you start seeing things like sulforaphane. You were talking about
Exactly.
that earlier, and it's like, wait, turmeric. You're starting to see these things. Like, wait a minute. I may be able to give you 3 or 4 supplements that can impact all these variants, and that you see that wave come over people because when they see the report, even if they look at the hospital,
Right.
they're like, oh my gosh,
Right.
I can't
Right.
take all these supplements. Like, no, we're going to start here,
Yeah.
and it may change, and that's incredible. That is very incredible. Kind of to wrap this up, on the website, it talks about making genomics actionable. What does that mean for you when you say that?
Yeah, I think that is, if anything were to be what is really special about IntellxDNA, I think that's a great place to end, because we say, people always ask us, what's different between you and this tool, you and that tool, because there are other genomic platforms out there. And the 2 differentiating features are the evidence-based. Every sentence is referenced. You can click on it so that if you're patient or from a medical legal, you're wanting to document, why am I putting this patient on estrogen for her brain? You can go, this person has this reason. They have an estrogen receptor variant with 3 times the risk of cognition, and that's why I believe estrogen will help, and da-da-da. So you have the references, but you also, ordering a test doesn't make sense if you don't know what to do with it. And most genomic tools will give really broad interventions, not specific to the gene variant that the patient has. And so understanding what's actually going on with the patient is really important. We heard in one of the talks today them talk about cardiac inflammation. And I was sitting there going, yes, but which kind? Because CRP
Right.
is different than IL-1 beta, which is different than interleukin-4, and which, there's different kinds. And whether someone has mast cell inflammation or an autoimmune or a vascular, all of those kinds of gene variants contribute to all of those different kinds of things. And so we give you a map of the person with gene variants that are clinically significant, but then help you do what we as physicians do best and take it to the next level and know how to talk about it and address it with the patient. So that's the actionable.
Right.
And why do something if you don't know what to do with it?
That's super important.
So.
But for the doctors and clinicians that are going to be watching this later, how can they get started? What's step 1, getting started with IntellxDNA?
They can go to the website and request an account or request a tour. We like to show people the platform one-on-one and give them an opportunity to see it firsthand. So they can just contact us directly through the website.
And it's spelled INTELL, 2 L's, like an intelligent approach, and then XXDNA. So it's an intelligent approach to DNA. And the 2 X's are because 2 women co-founders.
Carol and Sharon, the buddy cops of genomics here. So no, this has been awesome, and I thank you guys for your time, and I'm sure I'll be seeing you around more.
Thanks so
Great.
much.
Thanks so much.
Thank you.